The critical shortages of medical supplies in many impoverished nations limit the provision of basic health care and may be as demoralizing to physicians and nurses as is their huge workload. In the medical care facilities of the developing world, improvisation and reuse are not the exception, but often the rule for many basic supplies. Items such as Foley catheters are rewashed and hung out to dry for reuse, and surgical gloves may be re-sterilized or, if damaged, fashioned into surgical drains. Surgical drapes may be found drying in the breeze due to a lack of essential facilities. Because some hospitals cannot afford to maintain stocks of supplies, patients are often required to arrive at the hospital with pre-purchased sutures, bandages, and other items required for their own operations. This is even true for emergency room visits. In the developed world, not only are our stockrooms well inventoried with a seemingly endless supply of the most state-of-the-art equipment, but due to a sense of immediacy in the interest of optimal surgical management and protection from litigation, more than the requisite supplies are typically opened for a given operation. These materials are routinely discarded as regulated waste. While collection and donation of such supplies has been practiced by individual healthcare workers for many years, such efforts may be erratic and possibly place the individual or institution at legal risk. A widespread, standardized means of material recovery could more effectively address the need for supplies in the developing world. In an effort to address these issues, R9MPG was created. R9MPG stands for Recovered Medical Equipment for the Developing World and consists of a dedicated group of volunteers at the Yale University School of Medicine in cooperation with the staff of the Yale New Haven Hospital. A simple, safe, and efficient method has been developed for the recovery of gloves, syringes, sutures, and many other surgical supplies remaining on the surgical scrub table at the end of a procedure. The R9MPG recovery method begins when a case cart is being prepared for an operative procedure. A bag for collection of recovered material is included among the other routine supplies. After an operation, the scrub nurse reviews the scrub table for items whose sterile packaging has been violated, but which have not been used in the surgical procedure, nor noticeably contaminated. A list of items commonly recovered by our program is included in the in-service packet we have sent you. Materials with exposed sharps or any visible evidence of contamination are discarded. Items which may have been accidentally contaminated by reasons other than contact with the patient can also be recovered and placed in the R9MPG bag. Immediately following the procedure, the bag is placed with the contaminated surgical instruments and the case cart is removed to the operating room decontamination area. From this point until decontamination is complete, the bag is treated as regulated medical waste and is removed by the hospital personnel handling the contaminated instruments. The bags are placed in clearly marked bins in the decontamination area. 2 or 3 times each week, the bags are emptied by a designated individual who inspects for unsuitable materials, for example, accidentally recovered open sutures and soiled sponges. This person wears gloves and gowns taken from the recovered inventory. Since there is evidence that gas sterilization may damage them, sutures and bottles of solutions are separated. All other materials undergo ethylene oxide sterilization and aeration. This sterilization protocol is identical to that used for reusable materials at Yale New Haven Hospital.
Decontamination of recovered materials occurs only when there is surplus room in our sterilizers, thereby incurring no extra cost to the hospital or contributing to atmospheric emissions.
R9MPG feels that these precautions are necessary to ensure safety during handling in the remote chance that the recovered materials have been contaminated. After decontamination, all items are again inspected for obvious defects and sorted by trained persons. In our hospital, this task requires 1 to 2 hours of volunteer work each week. In general, we sort 1 item per box, and the boxes are marked to denote the specific contents. Charitable organizations with which we have communicated express dismay over receiving unmarked and unsorted boxes of materials. In this situation, this life-saving material may become a burden and is often discarded or pushed into the back corner of a storeroom. When full, the boxes are weighed and inventoried on our computer database. Each recovery group is encouraged to maintain such an inventory. Recovery has become part of the daily routine in the operating room and has fostered a sense of pride and cooperative achievement among the various staff. A survey of operating room nurses and technicians has revealed that no significant effort or time is added to the workday. But even more material is recoverable. In addition to the daily collections, the nursing staff and supply managers periodically review the operating room inventory for items no longer used due to changes in surgical techniques or expiration. In addition, the Remedy program has also identified areas of unnecessary waste and reduced red bag disposal at the hospital. Since this regulated waste would require special handling, the savings to the hospital is over 6 times greater than the minor costs of the program. Several nurses also reported that they use the program as a teaching tool when instructing students on efficient procedures and standard precautions. Your program will begin to recover boxes and boxes of materials in a short time, and nothing is liable to bring your program to a dead halt faster than the lack of storage space. We have sent you information to help with the task of identifying a charity who will accept your material, but you should conduct a search in your own community for university, religious, and other groups who have the experience and facilities to transport materials to the developing world. Choosing a receiving charity should be one of the first jobs of your recovery effort. Remedy procures these materials, but must rely on the experience and know-how of an established receiving charity to transport materials to the developing world and distribute them appropriately. Remedy strongly suggests that your program identify 1 or 2 charities to donate the bulk of your materials to. A long-term relationship with a receiving charity is encouraged. Experts in international medical supply aid have stated that recovered supplies are not useful in emergency or disaster relief. We are delighted by the success of the facility-wide recovery program. We think that you will be too. The potential benefits are real. The structured, integrated nature of this program addresses concerns about safety, cost containment, environmental waste, and most importantly, medical needs of the ill and impoverished.